Now, want to look at another classification of neuropathies, that's nerve diseases or nerve injuries, and this is based on if they are actually from metabolic issues or if they are from toxic issues. Do you understand? So metabolic issues is where you're now talking about imbalance of electrolytes in the body. Toxic issues, of course, is where you're talking about there's an external toxin coming into the body to cause issues. So acquired metabolic and toxic neuropathies, of course, we'll explore the examples, okay, under each classification. So they're actually peripheral nerve disorders caused by maybe systemic metabolic imbalances, like I was telling you guys, imbalances in electrolytes and all of that, or maybe you were exposed to some toxic stuffs, poisons, okay. So these conditions can result into damage of your nerves. Do you understand? So under the metabolic, which is more of like imbalance, causes could be what? Or examples: diabetic neuropathy, of course, caused by diabetes, which is like high levels of sugars in the body. Uremic neuropathy, where the person has a lot of kidney disease, so there's accumulation of toxins because the kidneys are not being able to filter out. The hypothyroid neuropathy, okay, this one, there's low thyroid hormone levels, okay, and this could actually lead to slow nerve conduction. The vitamin deficiencies like vitamin B1 deficiencies, vitamin B12 deficiencies, vitamin E deficiencies, okay. Then for the toxic neuropathy, like what are the possible toxins that could lead to issues with your nerves? So chemotherapy toxins, that's like drugs, okay, maybe drugs is for cancer, like vincristine, cisplatin. Antiretroviral drugs like stavudine, okay, isoniazid, nitrofurantoin. Alcohol can be chronic, okay. Heavy metals like lead, arsenic, mercury, as we always talk about, on that when we're talking about environmental pathology. The industrial chemicals like what? Acrylamide, okay, organophosphate, all those shetox, insecticides and the rest of them. The solvents. So clinical features is symmetrical distal sensory loss. So the issue usually happens on the extremities. That's your hand, legs, and the rest of them. Burning, tingling, or numbness, weakness, reduced reflexes. Okay, all of these could be issues. So management is you have to remove or treat the underlying cause. Okay, nutritional supplementation, symptomatic treatment. Okay, where you get to manage, the how do I put it? The pain and the rest of them. They keep monitoring and prevent any of those toxins from coming to the person.